Um, I know there are different scores on for the equipment or so. Um, is there a category? I mean, how bad can you be um, uh,
Oh,
to uh,
yeah.
to be assisted?
Sure, sure. I think it's important to mention that the assistance that is provided by either the upper or the lower extremity device, the
Mhm.
Motus hand or the Motus foot, conveniently noted, um, their ability to help someone can vary.
Okay.
We term this dynamic assistance, meaning the amount of assistance that can be provided can go from zero all
Mhm.
the way to 100%. So, in terms on the zero side, someone could just use this as a means to improve their precision of motion. Right? They may not need help to either initiate or complete a task, but they may need to have that feedback to learn what we talked about before, learn precision of movement. And on the other side of that spectrum, someone who has great difficulty either initiating or completing motions can rely on more help from the pneumatic actuators that can provide that assistance. So it kind of can change, much like your intuition before, Charlie said, what can it do to help? That help is not static across the path of recovery. That help, that assistance can also change with respect to someone's capabilities.
It was a very interesting point where you said that the mean age of the
Mm-hmm.
people getting a stroke are younger. I mean, just from my experience, most of the people in mom's one, they're relatively older people. And there's some young people here and there, but um, I can see if you would have those conditions when you were very young, yeah, you're set up for a long time dealing with some of these issues.
Yeah, and some of these trends are, of course, multifactorial insofar as it's many things, other lifestyle, dietary choices, cardiovascular health. There's so many factors that contribute to these rates of stroke. You can kind of think of the rates of cardiovascular disease and stroke kind of going hand in hand, right? Because fundamentally, it's a problem generally of plumbing, right? Where the blood is not getting to certain areas, or in certain areas, you might have a burst because of some genetic malformation, these sorts of things. And so, yeah, it's a surprising fact. It's a surprising epidemiological fact, and it also really brings to light. It really underscores the importance of these approaches, because if you're having strokes earlier, and we have an increased probability of surviving those incidences, then we have a large population of individuals who are going to have most likely residual impairments from that. Not only on the physical side and physical domains, but also potentially on the executive, visual, cognitive domains as well. And so these effects are going to be profound in affecting people's quality of life and their working capabilities, for instance, and so how they contribute to society. So I think, yeah, it's a tough arena to be in.
We
Yeah.
appreciate all your efforts on trying to heal people up.
Well, thanks, Charlie. Yeah, and this is really good. And I think I'll just again reiterate that you are always welcome to come back. If you have more questions, do not hesitate to reach out to us. We will do our best to answer those questions for you. And if we don't know the answers, we will find someone who does. So thanks so much.